Today, we're talking about how Americans are dealing with the pandemic when it comes to their physical wellness and their mental health. I welcome to the conversation Dr. Andrea Klemes, Chief Medical Officer of MDVIP. Thanks for being with us, Doctor.
Thanks for having me today.
Of course, we're looking at a new nationwide poll that really focuses on how Americans are dealing with the pandemic, and you found a lot of anxiety. What were some of the important takeaways from this poll?
Sure. I think Americans are going into the perfect storm. The MDVIP survey showed 1 in 2 are stressed or depressed. 1 in 3 have developed some unhealthy habits like eating more or drinking more. And over 60% have canceled a doctor's appointment. So when you add all those things together, it's very concerning as a physician for short and long-term health of Americans.
Right. Today, we just had a story on our morning newscast that people are being urged not to go to the dentist for routine checkups because, of course, you have your mouth open, you're using, spraying instruments. Um, all along, I thought I should be doing everything I could to maintain at least my physical core health. So if COVID happens, I might be okay.
You're totally right. You need to worry about, if you have any complications. Partnering with a physician, like an MDVIP physician, is really important because they need to know your risks. To that point, I don't know if you know, but if you get a viral infection, your risk of heart attack goes up sevenfold. So that if you were even at a little bit of risk, maybe you had pre-diabetes or something, you wouldn't have even known that unless you had somebody you've partnered with and you know what your risks are.
And I know that many people are, in normal times reluctant to go to the doctor. Many people are now finding that they can't go unless they have an emergency. How can we be our own best monitors of our health?
Yeah, actually, 10% of people in the survey said that their doctor's offices were closed, and they couldn't even get through, which was in contrast to some of, I know, our MDVIP offices who were proactively reaching out. But I think, you need to know, watch your weight. I mean, there was a silver lining in the survey. 70% of people said they wanted to prioritize their health. 1 in 2 said they would eat better, exercise more, get better control of their weight or their chronic conditions. So I think your best advocate is making sure you know your own risks and then trying to adopt those behaviors that aren't going to make those diseases worse.
What did the survey find about Americans' mental health?
Yeah, so besides 1 in 2 being stressed or depressed, it was interesting. I would have thought that the 65 and over group who are at higher risk for complications may have been faring a little bit worse, but they honestly are coping better. It's that sandwich generation, taking care of your parents and your kids. They are coping worse. And in fact, 1 in 2 said they felt like they're losing their mind.
And do you, I mean, look, and a typical day as a member of the sandwich generation can be difficult. What particularly about this pandemic is hitting those of us who are lucky enough to have parents on this side and little ones on the other?
Yeah, I mean, I think it's, the little ones, virtual school is starting in so many places, and we were in virtual school. And of course, in the summer, it was trying to keep them busy. And so you've got the kids at home, everybody's working from home, you're worrying about your parents and their health. And, I think from the unhealthy habits piece, if you're working from your kitchen, you look like you're working from an office, but if you're working in your kitchen because your kids are somewhere, the refrigerator is right there. It makes it very easy to grab that snack and or just go down to the kitchen for a break and check on the kids. And so I think it's just much easier to fall into some of those bad habits.
I'm working from home for the first time ever. I've been home since mid-March. I'm in the San Francisco Bay Area. And I used to think that I didn't have the discipline to work from home. And it turns out that I do, right? But the day is never ending. There is no nice cap to the end of your workday where, the boss doesn't text you anymore or there aren't new requirements for your next day tomorrow. I imagine that's a source of a lot of people's stress as well as millions are working from home, many for the first time.
It is. And I think, we're getting so much information from everywhere that is even adding to that. The MDVIP survey showed that most people are getting their information from local media. So kudos to you because they need that, right? You need to know how much virus is in your area and all. But they're not going to their doctor for their own personal risks. And so they need to do that also. They need to take a break sometimes. from the deluge of information, right? Go take a walk outside and increase those endorphins and make yourself feel a little bit better.
We were very much reluctant to have to call the doctor earlier in the days of the pandemic. One of our young sons was sick, and in any other time we'd say, oh, it's just a little cough, it's a little cold. But of course we thought, this is it, it's hit our son, it's coming to our family. How do you help people navigate the fears that every little cough is COVID, every little sneeze is something terrible?
Yeah, actually, 40% of people in the survey are feeling they're more paranoid just because of that. A cough, oh my goodness, what do I do? It's having that partner and being able to call somebody and saying, I have a cough, but you know what? I have allergies. I mean, personally, I do have allergies. I've had allergies for years. So, somebody who can calm you down a little bit and say, well, I've been using your nasal sprays, what's the pollen count like locally, and helping you through that. Or if your son really did have an exposure and did get a fever, then you need to just get him tested and, worry about following along, and hopefully they do fine.
For people who are hearing about MDVIP for the first time today, how does it work?
So it's a national network of primary care physicians across the country. We have over 1,100 physicians, and you join the practice, and what you get is an executive style physical, a host of screening services, and then you have a partnership with that physician for the whole year so that they can work with you to make wellness goals with you and really coach you to keep and help you live your healthiest, most vibrant life.
I imagine a lot of the work that would normally be done in a doctor's office is being done through telemedicine.
It is, depending on where you are in the country, in many of our offices, many were, in certain areas, the health department was doing the tests, and so those doctors were just seeing healthy patients. In other places, our doctors were setting up swabbing clinics on the roof of parking garages, and just had people coming through and swabbing them and then seeing others in their offices. So really having somebody who you can get in and work with, but telehealth works for somebody who's older maybe and has some chronic conditions, seeing the physician, letting him see he or she see your face to know, do you still look healthy? Are you looking gaunt? Did you gain weight or lose weight? You can't lie when somebody's looking at you in the face if you've gained 30 pounds. I mean, you can tell, right?
Right. And especially when we talk about elderly Americans, weight can be a very important health indicator.
It is, and we know that weight, being overweight or obese, increases your risk for complications from COVID-19. So that's an easy thing that if, the silver lining in the study, the 70% of people wanting to prioritize their health. I mean, if you prioritize it and you start working, and you could do little things first. I mean, if you were going to fry something, maybe bake it. If you were going to make mashed potatoes, maybe instead of using butter and milk, use chicken broth. You get the same consistency, a lot less fat. But all those kind of little wins can make you really turn the corner and hopefully live a healthier life.
If we can swing back quickly to mental health, because I have an expert before me here on overall wellness and health, there are so many unknowns. I have two little children who are doing distance learning. They're asking me, when can I go back to school? I want to know when I can get back to my newsroom. And I've sort of trained myself, and I tell my little ones, I think about today and I think about tomorrow, because all those other big questions I don't have the answer to. And I feel like I'm just wasting my time and energy if I worry about them. Is that the right thing to do?
I'm listening to you going, yeah, I couldn't say anything any better. I mean, we don't know when there'll be a vaccine. We don't know what the flu season is going to bring. Although I'm very optimistic about that, with everybody wearing masks and socially distancing and washing their hands. Hopefully we'll have much lower flu season. And so we can, once we get vaccines and get some herd immunity, hopefully we can get back out there and get back to normal. I can't imagine having little ones because mine's a little bit older than that. And so, more video game related than worrying about, mommy, can I get outside? But it's hard on every different generation. And then for the older people who want to see their grandkids. But that's one of the most worrisome things, is bringing older people into the household. One of the interesting things in the survey, 90% of people said they knew all about the risks and everything. But when we asked them to rank what the riskiest places were, public transportation was highest, which is pretty risky. Hospitals and doctors' offices were very high up, which are not very risky. And then the safest, outdoor parks, pretty safe. and family and friends' houses. And that's where all the transmission is now, is people saying, well, my kid's been cooped up, I'm going to let them go over to their friend's house. And there were 4 kids over there. And before you know it, those 4 kids go drive in a car for an hour and a half, and then everybody has it.
Right. It's, so my boys are 10 and 11, so I guess kind of medium sized, not super little anymore. But we have gotten together with a couple of other families. We get together at an outdoor park. The children wear masks. They know not to touch. We played kickball, so no one's actually touching, let's say, a baseball or a frisbee. Is there anything else you'd like to add for those parents to say, look, I cannot survive another month with just having me and my partner and my children in this tiny house? If we need to get together, what's the best way to do that safely?
I think you just said it. I noticed I was playing golf with my husband recently, and there were 6 older people sitting under a big oak tree, and the 3 different couples were all like 15 feet apart from each other and sitting in a circle. Luckily, it's summer, so it's a little bit hot in a lot of places, but you can get outside a little bit more. Maybe go to the beach, but again, masks and trying to stay as far apart as you can, and keeping the kids active is important too.
Absolutely. It's, whenever we come home from one of those outings, the children look and feel better than they have, at any other point in the day. Finally, Dr. Klemes, for people who want to learn more about MDVIP, where can they find information online?
Sure, they can go to mdvip.com. They can learn more about the survey, COVID-19, and to find a doctor in their area.
All right, Dr. Andrea Klemes, Chief Medical Officer of MDVIP. Thank you for joining me today.
Thanks for having me.